Well, hello, ladies. Welcome to Wellness Wednesday on Tuesday. um, Hope you're all having a wonderful day. And as, while we're waiting for everybody to just kind of trickle on, I'm going to say my disclaimer and then we'll get into our topic. Um, Anything that I say tonight is simply health information and not health advice. Do not stop taking, change the way you're taking any of your medications. If you feel like you need to do so, please first consult with your prescribing practitioner so that they can help you do that safely. And by attending this Wellness Wednesday tonight, this doesn't establish a doctor patient relationship. And I'm so glad you're joining me tonight. I know we're all looking forward to the holiday season, and so we're thankful to be able to at least meet with you. I'm super grateful to be able to meet with you all tonight and talk about, you know, going. I've gone through the, you know, the Facebook page, and I love going through the page. Um, and I see how many questions you all have, and you're asking great questions. And many of the questions you're asking, I am going to be covering during the master class. But before every master class, and I've seen several questions recently, I get questions about who this class is for. So we're going to talk about that a bit tonight. And I appreciate you taking time out of the the busiest shopping day of the year, right? One of the busiest, and brave the traffic. And now you're home safely, hopefully, and now you're with us. So um, glad that you're here, and let's talk about who this is for. I know many of you are in this group. Well, you're all in this group for so many different reasons. Whether you whether you have hypothyroidism, whether you have hyperthyroidism, Hashimoto's, Graves, whether you have no thyroid, it's been removed, it's been irradiated, um, maybe even born without. Now I'm gonna talk about these different scenarios because it's so important, especially ladies who have had um, hypothyroidism, yes, but one of the things I discuss in the class, so this is especially for ladies with hypothyroidism, uh, you often have problems with weight gain, and you don't even know why you have hypothyroidism, and you don't know why you're still having a lot of the symptoms that you're having. I'm going to get into those too, and so I'm going to dig deep into the most common reason why you have hypothyroidism and why this leads to the weight loss issues that you've been having or trouble losing it and keeping it off. And so for those of you who have Hashimoto's or Graves, this is such an important reason why you should be attending the class, because whether you have you'll need to have an understanding of, one second. Okay, sorry about that. Need to have an understanding of what you're going through with this autoimmunity. And so I'm going to dig deep in the class about what impact Hashimoto's has on your body when you have autoimmune disease. And you may not even have Hashimoto's. You may have another autoimmune disease. But it's so important to recognize that when you have any autoimmune problem, then the key to understanding this is what's triggering this, your immune system, what's triggering your immune system to attack and destroy your thyroid. So for those of you who have had your thyroid removed or half removed, it's been removed for a reason. Generally, it's likely due to thyroid cancers or nodules that have been kind of out of control. And so they've removed part or all of your thyroid gland. And and in this case especially, you still have symptoms because what was causing the autoimmunity and the cancer in the first place, and I'll be clear, the autoimmunity causes the either the hypothyroidism causes hyperthyroidism. If it's Graves, it just causes it to go really, be very hyperthyroid to the point where, you can have, you know, uh, heart attacks and strokes and high blood pressure and, extreme anxiety and heart palpitations. It just happens very rapidly. With Hashimoto's, it can happen as well, but it generally is a little more gradual. That then throws you into hypothyroidism, and and then the Hashimoto's can cause these nodules to form, and which turn into cancer. So there's these underlying reasons why you've had to have this removed, and just by removing or burning out or irradiating the thyroid, that doesn't fix the reasons why your immune system was attacking in the first place. So you still very likely have these same imbalances, these same triggers going on now. And so this is why this is especially for you ladies who have had your thyroid removed, whether it's due to Graves, Hashimoto's, thyroid cancer, etc. So it's important also to recognize that when you have one autoimmune disease, you're at risk for developing and having multiple autoimmune diseases and other types of cancer as well. Um, so finding out what you need to know to fix these issues is super important. Look, you still have the symptoms, right? That's why you're in the group. Why didn't taking my thyroid out help me? Why didn't putting me on, the levothyroxine or the Synthroid or the Armor help? It's because you're still having symptoms. Ladies, let's talk about why our body gives us symptoms. All right, symptoms give us they're warning signs that there's something imbalanced in our bodies. Symptoms are the, you know, dashboard, the warning, the check engine light going on your dashboard and warning you that something is going wrong. It's trying to get your attention, right? Your body's trying to tell you that something's wrong. And so it can be anything. It can be, especially when we're talking about low thyroid symptoms, the fatigue and exhaustion some of you ladies have, the trouble sleeping at night where you can't get to sleep, can't stay asleep. Usually it's not being able to stay asleep, but it can go both ways. Not getting restful sleep. Um, it's where you develop digestive issues, and uh, of course you can't lose weight, and you can't. Maybe some of you, um, have anxiety and depression and brain fog. These are common symptoms of hypothyroidism, and this masterclass is for you if you have any of these symptoms, because I will be going into why you have these symptoms, why you have these imbalances, and teach you all about that. One of the most important things that I want you to take away from tonight and take away from the masterclass is that your body is born to heal. You have the ability, the power to heal. This body we have, it's a self-healing organism, and you don't have to think about it. You don't have to think about, when you get a cut, you don't have to consciously think about, well, is this going to heal? What am I going to do to make it heal? No, this is something your body just naturally has the ability to do, and it's amazing. It's truly amazing. And like I say, it does it without you even thinking about it. Just like you don't have to think to breathe. You don't have to think to, you know, um, to digest. I mean, it just does this for us. At the same time, your immune system is so amazing, and it helps you to heal. It helps to take care of you. When you get sick, when you get a cold, you get over it. Your body can get over it. And sometimes, admittedly, it needs a little help to get into balance. Uh, I'll tell you, a smart doctor gave me some really important perspective that I've never forgotten. And it is that we expect a lot from our body without a lot in return. Okay. Now, we kind of eat what we want to eat, right? And we take on all these different toxins, and these imbalances start to occur, and they just get worse and worse. And sometimes and often they just get too large for our bodies to overcome without help. And I'll tell you, every day I meet with ladies who have got their tests, their comprehensive tests, and I show them what their root causes are, and really to help them also to see if there's a path forward to helping them overcome these imbalances that their bodies simply can't do, uh, you know, on its own at this point, because they're too big, they're too large, they've gone on for too long. And this is where, if they've got a path forward with a customized plan to be able to help them, then they are much more likely to be able to overcome these imbalances. And it's rare if I cannot find the root causes clinically with this comprehensive testing that I will be covering in depth in the masterclass. Um, and so it's nice because we're able to see what these imbalances are, what these root causes are. And as I go through, the group in the Facebook group, and I'm scrolling through, and what do I see? I see all these testimonials, all these patient success stories that are telling us, that sharing with us that they've, not only are they losing weight, but they're also overcoming the fatigue, they're resolving their anxiety and depression and the brain fog. They're focusing better. They're happier. They're overcoming these mood imbalances that they have, and they're experiencing life again like they truly dreamed of experiencing. And that's it. Does a couple of things for me. It reminds me, first of all, that why I'm doing what I'm doing. It reminds me that I've got a really important mission, that I've got to work harder too, to help as many people, as many women especially, as I can, to overcome these imbalances and these root causes, to help them have better lives, so that then they can turn around and help the others in their lives, their friends, their families, their husbands, their spouses, whoever it is, that uh, because they see their examples, right? They see their efforts, and they're inspired by the results that they're getting. And it also reminds me that we really are not meant to suffer. When we see successes like this, um, I know that we are not meant to suffer. There's no reason why we need to why we can't overcome this and just get into a place of healing, because that's what we're meant to do. Our bodies have this power to heal, and it gives us symptoms. Our bodies tell us what's going on. They're trying anyway. They're trying to give us these symptoms. So the master class is about explaining what these mean, what comprehensive testing is, and what to do with the information so that you can finally overcome these symptoms and get relief and results finally. For those, of course, this masterclass is about weight loss, and so for those of you who look, a lot of us can lose weight. You can lose weight, right? You can do short fasts. You can do intermittent fasting. You can just starve yourself for a little bit and lose some weight. But the trick is, what happens after you do that? What happens when you go back to eating the nutritious food? Because if you don't, there are going to be other consequences but then you gain the weight back, right? When you go back to eating the way you were. And so what happens, ladies, if you need to gain weight? Is this, master class for you if you need to gain weight? And I'll tell you, low weight, underweight can also be a symptom of low thyroid. This is very important. So when we talk about the nuances there with, why, there's general, certainly there are some general guidelines as to what we should be eating, what we should be doing, but it really comes down to what information we can get for you with comprehensive testing. And then this is it, ladies, customized care. It all comes down to customized care. That's where we explore the nuances that are affecting you as an individual. Okay. Yes, you can follow certain guidelines, and that's all I can really give you. And I will give you so many general guidelines in the masterclass. That's why this is such important information. But then you'll learn how to get to the point, move forward, and get help to identify the nuances that are specific to you. Okay, what you will need in a customized plan, because again, these imbalances have gotten so to the point where your body's simply not able to, you know, overcome them. So many of you are on medications, and we see so many of these testimonials and these success stories with patients coming off their medications, no longer needing the blood pressure pills, no longer needing the antidepressants, um, and cholesterol medication and all of these. Sometimes not even needing prescription thyroid, synthetic medications. Um, and that's not the rule. It's more the exception, and I'll explain that in depth why that is in the class. Because when it comes to the number one reason why you have hypothyroidism, doctors don't even test for that. They simply don't even test for it. I'm going to share the 12 markers in a complete thyroid panel that you need, we check on every patient, that we need to have in order to get the full picture and be able to then identify why why you may or may not need that thyroid medication, or if you do, why it's so important, and why your goal shouldn't be to get off that sort of medication. Whereas maybe the other medications you're on, yes, you could maybe get to the point where you can do without them, like so many of our patients have been able to. What happens if you're hyperthyroid, or you're on medication to combat that? Maybe they didn't take your thyroid out. Maybe it maybe your particular doctor didn't see the need to do that, and they were able to control this hyperthyroid with medication. Is this class for you as well? Absolutely, because I'm going to go through that, those markers and what they tell us, and and get into what's causing those symptoms and what's causing your thyroid to behave this way. And so, um, a lot of you have as well so many questions about what food to eat, what labs to get, what medications should you be on when it comes to low thyroid, and what about the supplements that you should be taking. So you have all these questions, and it's great because when I do the master class, of course, I'm going to probably answer a lot of those questions, like I said in the beginning. But if I don't, then we're going to have a live Q&A at the end of the masterclass to go over a lot of your questions and answer them, give you the information that you need to move forward. So I did want to share. It never ceases to amaze me. The successes that we see, patients that even just implementing what they learn in the masterclass, just implementing a few of the things that they learn in the masterclass, they see results, and it's fun to see those comments in the group as well. But those who have gone through the class and those who have been successful as patients, I want to share why this information is so valuable, just to give you an idea of what is possible. And so sharing a little bit about this, I think, will be helpful. Um, you know, Chris, now she was dealing with Hashimoto's. She had no energy. She was uh, in the stage of her life where she, is postmenopausal and um, dealing with a lot of low energy and low interest in things, pretty much just low motivation. And really, the only thing that was keeping her going was that she was watching her little granddaughter, and yet that was all she could do, to watch that little girl. I want to say about a year old, a year and a half old. All she could do to keep up with her. Had to nap when the little one was napping as well. Had stopped putting up her Christmas decorations, stopped decorating for Thanksgiving, and stopped, Halloween. And she loved to decorate for these things and loved to keep her house organized. And it was just going by the wayside. Loved to garden and had not planted a garden in want to say 2 or 3 years, and just exhausted. She has this Hashimoto's. She discovered this with the comprehensive testing, and moved forward and became a patient, worked on these things. When I spoke to her about spotlighting her because she'd made such an amazing turnaround, uh, she was in tears because it had changed her life so much. She has the energy now to watch her little granddaughter, and now she can, put her granddaughter down for her nap, and she's able to go and do the things that she needs to get done, can decorate now, and has the energy to go out and work in the garden again. So she overcame the imbalances and the triggers that were, helped her put this Hashimoto's into remission. Hazel, now she had thyroid nodules, and she's in her 80s, 83. And you've probably seen some of her comments in the group because she's very active, and she's grateful to have gone through this program and got the information from the master classes. And in the end, her thyroid nodules have shrunk, and she has energy to continue working every day, which she does. And she was able to shed a significant amount of weight during her program. I want to say it was over 50 pounds that she was able to shed, and feeling so much better and stronger and active and vibrant. And so uh, even these nodules that were caused by Hashimoto's were able to be, overcome, because she was able to fix these imbalances, overcome these imbalances with some help. Now, Diane had a thyroidectomy from thyroid cancer, all right? And she dealt with still being overweight, high blood pressure, taking cholesterol medications, uh, pretty much a high risk with the insulin resistance she was dealing with, prediabetes she was dealing with, was at risk for, heart attack and stroke, that we found out with the comprehensive testing. And and with help, she was able to overcome these imbalances and get her energy back, shed a lot of weight, and get her, you know, underlying autoimmune condition into remission, all right, which had caused the thyroid cancer most likely in the first place. Um, and then finally, Marie, who was being treated for hyperthyroidism. She was taking a medicine called methimazole, and this blocks the thyroid production in thyroid hormone production in the thyroid gland. And so she found out what her imbalances were, what her triggers were for the autoimmunity that was causing her hyperthyroidism. And being able to get things balanced was huge for her, got her energy back, shed some weight, was able to overcome the pretty severe brain fog she was dealing with, and really start to be more productive in her work. So, ladies, it's it doesn't matter really what it is that you have, what symptom you have. Um, you'll need to attend this class so that I can talk about comprehensive testing with you and the blueprint that's literally helped thousands to get their autoimmune disease into remission. If you have lupus, Sjogren's, these are these same sort of conditions where your body is, your immune system is essentially attacking and killing those tissues and causing all these other types of symptoms, these skin issues, especially with things like psoriasis and lupus, once again, um, rheumatoid arthritis, causing the joint pain and deformities. Um, it's once you get the information that tells you why your immune system is doing this, all right? It's protecting you, but it's causing collateral damage in the process. Once you find out what is triggering this to happen and then addressing this with a customized plan, then this allows you, allows your body to balance things faster, get things in order quicker, and as we do so, your symptoms start to fade away. They start to be able to lose the weight and keep it off. Um, get get their energy back. This has helped thousands to accomplish their goals, right? To finally be get back to the woman they were. All right, they knew them that they could be again, and so uh, it's so fun to share this information. I'm looking forward to sharing this information with you starting January 5th. All right, so 5th through the 7th, those 3 nights, I go live at 7 p.m. sharp Mountain Time. All right, so that's 6 Pacific, 8 Central, 9 Eastern, and it's right here in the group. It's right here in the Facebook group, just like you're watching this, Wellness Wednesday this Tuesday night. It's the same thing. It'll be, in the featured section. If you can't find us at the top. You can swipe down. If you're using your phone, reset or refresh your screen, and then we'll be right at the top. You'll see our little countdown timer like you did tonight, exactly like that. Um, and I'll go for about 90 minutes. I try not to go longer. Sometimes, if I'm in a train of thought and I get going with it, then sometimes it takes a little longer. But I really try to stick with the 90 minutes. And I'll always share a lot of other bonus material with you during the class because there's so much that you need to know, and um, it's real important that I know you're all busy. I would set a timer like 20 minutes before, 10 minutes before showtime, so that it reminds you, okay, I got to get ready, get my workbook out. You will get a link to the workbook shortly before the class, the weekend before the class starts, so that you can take notes and capture all of the salient, really important points that I want to bring out in the class for you. Um, and lots of room to take your own notes and keep track of things as you learn. What if you've been to a master class before? Should you attend again? Absolutely. If if you've been to, one, two, three, attend again. Every time you learn, every time you get this information into your head, you're creating new neural pathways. You're then going to create new behaviors because you have new information that you're more cognizant of. And those new behaviors can yield better results for you. They can yield change, a change in your life, which it truly is life-changing information. And so I have patients here, even viewing tonight, that have been to several classes. And each time they learn something new, I'm sure they can vouch for that. Um, and so that's the purpose. And I hope that I've been pretty clear about who should attend this class. And if you have friends and family members, female friends and family members, of course, who would benefit from this information, you could be instrumental in changing their lives by inviting them to attend, by inviting them to be part of this amazing group of ladies who you all have the same purpose, really, and that is to find answers. You're trying to navigate this sea of thyroid information out there, and it's so difficult, and you don't know who to trust, and you don't know what to believe. And it really just comes down to, you know, is this information leading to success? Is this information helping others? Because if it is, then it's likely to help you too. Even if it means unlearning some of the false information that you've gathered over the years of, I know so many of you have researched for years, years and years. And and it that's how you have to judge this, right? So uh, I'm looking forward to sharing this information with you. Again, we start the 5th, go through the 7th, and we're gonna have fun. All right, you're gonna learn a lot. Again, for those of you who have attended before, those of you who are patients, attend and learn even more. And I always share some new information, yes, but by and large, I have to share with you the information that's truly going to change your lives. And I'm so excited to do that. All right. And I want you to enjoy the holidays. Uh, I plan on meeting next week as well with you. We are going to do it again Tuesday evening. So break the mold again. But I just want you to be able to enjoy, these holidays with your family and friends. So I'll look forward to seeing you all again right here next week as well for Wellness Tuesday. And one other thing, if if you have any questions about the procedure, watching, or when it comes time to download the workbook and print it out, Nikki is your Facebook concierge. So reach out to her. You can direct message her. You will be able to text her as well. Her phone number for texting only. Again, it's only for texting. She's not going to answer. She can't. Okay. It won't go to voicemail. So please just use this number for texting when you have a question for her if you can't reach her on Facebook. And her number is 208-842-4466. Again, that's 208-842-4466, so that you can reach out to her if you have any questions at all, so she can help you um, and point you in the right direction. Okay. All right, ladies, I'm going to leave it there tonight. I hope you have a very Merry Christmas, Happy New Year, Happy Holidays, whatever other holidays you're celebrating. I want you to, if you're off work at all, spend some time rejuvenating yourself, recharging yourself, and uh, working on your goals and thinking about what your goals really are, because we will talk about that during the masterclass as well. I take everybody through a really important exercise that helps you to be successful more than anything else. So you won't want to miss that. Ladies, that's it. I'll leave you there. Have a wonderful night and an amazing rest of your Christmas week. And remember, you still have the power to heal. Good night, everyone.